Good morning, North Dakota. Thank you for joining us today. As always, I'd like to begin with gratitude, and there's lots of gratitude we need to share, but specifically today, I want to say thanks to the healthcare workers across our state who've been on the front lines since the very first case was identified in North Dakota on March 11th, 2020. So that's over 18 months that some of these dedicated workers have been working in our skilled nursing, basic care, assisted living, our hospitals and our clinics around the state, and doing great work. And those individuals on the front line of healthcare today are under increasing pressure from the latest surge in COVID cases on top of what is already a high patient load in our state's hospital. They have been and continue to be the real heroes in this fight against this invisible and we now know ever-changing threat. For context, as we entered 2021, let's take a look back a year ago. COVID has changed. The Delta variant is more contagious than previous versions, but we also have got better tools to be able to fight COVID than we ever have before, that we didn't have a year ago. And part of the reason we're having this press conference today is to help people understand that we do have a hospital capacity issue that is present and looming. Other states with comparatively low vaccination rates, other states like North Dakota are seeing their hospital capacity stretch to the limit. Many of us have now heard that in Mississippi, in addition to the dealing with the storms battering the Gulf Coast, they've had to open a field hospital and a parking garage under the crush of COVID patients. So across the southern states with low vaccination rates, they're seeing this surge in hospitalizations, and we want to make sure that North Dakotans know that the risk is real. That with the low vaccination rates we have in our state and parts of our state, that we could be finding ourselves in that same kind of position. So this is a readiness call to the citizens. We don't want North Dakota to ever to reach that point, and we're fortunate today to have representation from our state's 5 largest health system. They're going to all be speaking firsthand about what they're seeing and what we as citizens can do to ease the pressure on North Dakota's nurses, doctors, and support staff, and to make sure we got the capacity not only to care for COVID patients, but for all patients in North Dakota, whether it be for chronic or acute reasons that they need the highest levels of care. With us today that you're going to be hearing virtually are Janice Hampshire, the Chief Nursing Officer at Altru, Dr. Carrie Ward, the Chief Medical Officer at CHI Health Midwest Division, Dr. Richard Vetter, the Chief Medical Officer of Essentia Health, Dr. Michael LeBeau, President and CEO of Sanford Health here in Bismarck, and Dr. Jeffrey Sather, the Chief Medical Staff at Trinity Health. And joining me here today at the North Dakota Department of Health is our State Health Officer, Dr. Nazar Wiebe. We're deeply grateful for his leadership and of the entire North Dakota Department of Health as we continue to navigate this pandemic. Our healthcare systems in North Dakota have been doing a great job of getting the word out about this latest surge driven by the highly contagious Delta variant. And today we wanted to invite them all together to provide a statewide overview as we begin to find ourselves in a situation where sharp increase in active cases and hospitalizations is presenting a real risk to our overall hospital capacity in our hospital system. These partners have all been great at collaborating with one another, as they did during our peak last fall, and we're grateful that they're collaborating and communicating with each other today. But first, before we hear from those individuals, those professionals, let's take a look at where we are with the numbers in North Dakota. In terms of the active cases in North Dakota, we've got 2,442 active cases of COVID. That's up 188 from yesterday, following the big jump of over 500 new cases that appeared on Monday over the weekend. Our 14-day positivity rate is 6.5, and that continues to inch up. Comparing this, now that we can look at year-over-year numbers, comparing this to where we were at the beginning of August and the beginning of September a year ago, before that 2020 fall surge that resulted in our peak caseloads, we are actually on a trend line that looks less attractive and less promising than we were a year ago. You'll see on this next slide on our 14-day rolling average that we're slightly ahead of last year's pace, but it's important to note the curve of that red of that line that we have there. I think that we might have this actually labeled incorrectly. I apologize about that. The orange line is the 2021 and the green is last year's numbers. But so focus on that orange line, and if you see that, that's trending ahead of that. So over the past 2 weeks, those new cases have been climbing at a faster rate. When we take a look at the next slide, on recent positivity, we see the same trend line here, where the 6.5%, but the climb is coming steeper and earlier. So it started climbing in August versus in September. This is likely the steepness as a climb relates to the more highly contagious nature of the Delta variant, which can be has a higher viral load and can be transmitted in shorter exposure times. When we take a look at the vaccines relative to positive rates, we see that the percent positive at 6.5% on the previous slide of those people that are getting tested, that is really a positivity rate largely of people that are unvaccinated, because just 1 in 180 fully vaccinated citizens have tested positive for COVID-19. In contrast to the unvaccinated, 1 in 16 citizens are testing positive without the vaccine. Going on to the next slide, which is the key part of today's discussion, is the active daily hospitalizations. Again, you can see that this the trend line in hospitalization, it's not waiting until we're deeper into the fall. There was theories last year about that's when we got indoors and there was more potential transmissible moments that are happening. We've had great weather here in North Dakota. A lot of people have been outside, but again, the highly contagious nature of Delta driving up more positive cases in August. And then, of course, that's a leading indicator, followed by the more hospitalizations. You'll hear from our hospital folks that are going to be on the call today that in addition to this line being steeper, the hospitalizations also represent people that are younger than they were a year ago, and that's a reflection of the vaccine's effectiveness at protecting the elder and vulnerable populations. But where we are in terms of the vaccinations, we are at 52.2% of the population that's eligible to receive the now FDA-approved vaccines is 52%. Happily, over age 65, 77.2%. But if we take a look at this relative to the nation as a whole, it's important that we point out last year we had a lot of moments where we talked proudly about North Dakota leading in testing, leading in vaccine rollouts and other things. But currently we're in 42nd place out of 50 states. So we're in the bottom 10 in terms of vaccination. And it is what it is, but it does create more opportunities for the Delta variant to infect, creates more opportunities for the Delta variant to continue to evolve, and it is certainly a factor in what's driving our hospitalizations and our rates, as you have seen and will continue to hear from our other speakers. When we take a look at around the state, and because we've got higher vaccination rates in some counties, predominantly in some rural counties, but also in the eastern part of the state, we've got higher vaccination rates. We've got low vaccination rates in the west. This is important because we're now seeing that the active cases in the state are matching to the areas of low vaccination. And we also know that, as you'll hear, that most of our hospital capacity for treating COVID is in the east, not the west. And so we, again, grateful for our hospital leaders coordinating, because we'll find when we've got increasing cases and increasing demand for hospitalization in the west and available beds, hopefully in the east, it's going to involve coordination, perhaps transportation for people across the state to make sure that they have a chance to be served. If we go to the next slide, again, vaccines certainly are working. The vaccines, there's been a lot of talk about, oh, someone got reinfected with a vaccine. Yes, that's happening. It's happening among elder people. It's happening among elder people with low body weight who perhaps did not have a chance to build up the immunities. So while you hear Dr. Wiebe will talk about the boosters for that population so we can further protect those, particularly those in congregate living. But it is working. Only 1 in 2,700 fully vaccinated citizens have been hospitalized for COVID-19. Only 1 in nearly 16,000 vaccinated citizens have died due to COVID-19. And so again, vaccines are highly, highly effective at protecting against illness and against mortality. And when they protect against the illness, they protect against hospitalization, and that preserves that capacity. Just at the last full week of data that we have, or just a week ago, I mean, we have 135 North Dakotans that are hospitalized right now. There's actually more than that in hospitals with COVID in North Dakota because, of course, we serve South Dakota, Montana, and a lot of people in northwestern Minnesota. But a week ago, when we were at 89 North Dakotans versus today 135, 77 of those people in the hospital were not fully vaccinated. That's represented here by the large group. That group was younger and healthier. The group of people who were fully vaccinated and hospitalized were older, in many cases over age 80, and in many cases had other underlying conditions. And so again, the vaccines are working to protect our citizens from hospitalization and from mortality. We're super grateful to have all of our hospital leaders here to talk about what they are seeing. But as I close out that one section again, understand that folks have a choice. They can choose to be vaccinated or they can choose to not be. With the spread of COVID, choosing to not be vaccinated is also perhaps a choice that at some point you're going to get COVID. And we know that COVID is evolving. We know that COVID, for some people, results in serious illness and even mortality. And so again, it's not about what government says, it's about what people do. The importance of personal responsibility, which we've emphasized over and over again last year, is important now than ever. We encourage people to talk to their doctors if they've got questions about the vaccine. And we encourage citizens to listen to their local hospital leaders